This happened suddenly. I had diarrhea. For 2 days, then went back to normal. And 2 or 3 days again. Then back to normal. The diarrhea is on and off. For like 2 weeks. Then my right side stomach starts to have lumps. I picked up my stuff and went to the clinic. The doctor was very good. One touch at the lumps on my stomach. He advised me to go to the hospital. I can feel that. He knows something. In the hospital, I have to have some tests like PET CT, X-ray, colonoscopy and blood test. After the test, I have to wait for a week for the result. Then the results came back after 1 week. I was diagnosed with stage 4 colon cancer. It was a shock to my family and me. CT and X-ray show my large intestines have few tumors. Dr. Kim said that he needs an operation to cut out the tumor. That means they will be removed, my large intestine, and join my small intestine together to make my stomach function normal. Before the operation, I have to stay in the hospital for 2 weeks. I'm not allowed to eat. They have a special nutritional fluid that they use IV to put in my body. The fluid is white. It looks like milk. There is a tiny problem. I have a tiny vein. The fluid keeps making my IV area swell up. They have to change the IV needle location every day. If not, my IV area will swell up and it hurts. Every morning, Dr. Kim will come and check how I am doing. Every day, morning and night, the nurse will come ask me how much water I have drink, how many times I have peed and poo. On the 2nd week before my operation, they start giving me antibiotics to clean my body. This gives me diarrhea all day. Every day. My stomach lump area has grown bigger. It is painful to get up and down off the bed. Every few hours I have to walk very fast to the toilet. My poor butt is in pain because of the wiping. After a few times, I just use shower water to clean my butt. My diarrhea is not a lot. It was 50 cents big. Because of the fluid they give me. The operation day is in the early morning. The nurses came to take me to my operation room by bed. I just lay there. I was scared and curious. This is my first time. They took me to a room where there were other people waiting for the operation. The nurses will come and check my teeth, and also check if I have any allergies to med. Over there, I waited about 5 minutes. After that, they rolled me to an operation room. I have to move over to the operation table or bed. In the room there are doctors and nurses. The nurse asks to take off all your clothes and pants. I just lay there nude. They put a warm green cloth over my body. And also a white long sock and also a leg warmer. A doctor walked to my bedside and introduced himself as anesthesiologist Dr. C. After a few minutes everything went black.